To understand how glaucoma affects your eyes, it is important to understand how your eye sees. Light rays enter the eye through the clear cornea, then through the pupil and the lens. These light rays are focused onto the retina, a light-sensitive tissue lining the back of the eye. The optic nerve is connected to the retina and is made up of many nerve fibers. Signals from the retina are sent through the optic nerve to the brain, where they are interpreted as the images we see. In the healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant healthy eye pressure, your eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. If you have glaucoma, the aqueous humor does not flow through the drainage angle properly. Fluid pressure in the eye increases, and this extra force presses on the optic nerve in the back of the eye, causing damage to the nerve fibers.
A normal optic nerve is made up of more than 1 million tiny nerve fibers. With glaucoma, as the optic nerve is damaged, it loses nerve fibers. As a result, the appearance of the optic nerve changes. We refer to this as cupping. As the cupping increases, blind spots begin to develop in your field of vision. Ophthalmologists use a technique called a visual field test to look for these blind spots. The results of this test show us if and where blind spots are appearing in your field of vision, spots that you may not even notice. In the early stages of glaucoma, the visual field remains normal. As the optic nerve experiences further damage, blind spots begin to appear. These blind spots typically go undetected in your day-to-day activities until the optic nerve is significantly damaged and the blind spots become large. If all the optic nerve fibers die, blindness results. Two types of laser procedures called argon laser trabeculoplasty, known as ALT, and selective laser trabeculoplasty, or SLT, are used for patients with open-angle glaucoma. These laser surgeries are used to treat the drainage system of the eye, known as the trabecular meshwork. Treating this area of the eye's natural drainage system is designed to improve the flow of fluid out of the eye, helping to lower the pressure. The most common drainage operation is called a trabeculectomy. The surgery is performed in an operating room on an outpatient basis. This procedure allows your ophthalmologist to create a new drainage channel for the eye. The trabeculectomy allows fluid from the eye to flow into a filtering area called a bleb. The bleb is mostly hidden under the eyelid. When successful, this procedure will lower the pressure in your eye, minimizing the risk of vision loss from glaucoma. If your eye is at high risk for scarring and your eye pressure needs to be lowered to preserve your vision, your ophthalmologist may recommend placing a tiny drainage tube in your eye called a seton. This procedure is performed in the operating room as an outpatient. The drainage tube creates a new channel for fluid to flow from the eye to a filtering area called a bleb. A tiny plate placed on the eye helps the bleb form and remain open. The tube is covered with a patch and is typically not seen or felt. When successful, seton surgery will decrease the pressure in your eye, minimizing the risk of vision loss from glaucoma.